Acid-base balance can feel confusing, but I'll show you the easiest tricks to master it for Nclex. In this video, we'll go through 50 must-know questions with simple strategies that make ABGs quick and stress-free. Stay with me till the end, because these are the exact questions that keep repeating year after year, and you don't want to miss them. Question 1. The client's ABG results are pH 7.50, PaCO2 30 millimeters mercury, HCO3 minus 24 milliequivalents per liter. Which condition is indicated? A. Respiratory alkalosis, B. Respiratory acidosis, C. Metabolic alkalosis, or D. Metabolic acidosis. The answer is A. Respiratory alkalosis. Rationale: high pH equal alkalosis, low CO2 respiratory cause. Strategy: Rome rule. Respiratory opposite, metabolic equal. Question 2. ABGs: pH 7.30, PaCO2 50 millimeters mercury, HCO3 minus 24 milliequivalents per liter. What is the imbalance? A. Respiratory acidosis, B. Respiratory alkalosis, C. Metabolic acidosis, or D. Metabolic alkalosis. The answer is A. Respiratory acidosis. Rationale: pH low equal acidosis, high CO2 respiratory cause. Strategy: CO2 increase equals acid increase, hold your breath equals acidic. Question 3. ABGs: pH 7.30, PaCO2 38 millimeters mercury, HCO3 minus 18 milliequivalents per liter. Which imbalance? A. Respiratory alkalosis, B. Metabolic acidosis, C. Respiratory acidosis, or D. Metabolic alkalosis. The answer is B. Metabolic acidosis. Rationale: pH is low equals acidosis, HCO3 low equals metabolic. Strategy: bicarb equals base. Low bicarb, no base, equals acidosis. Question 4. ABGs: pH 7.48, PaCO2 42 millimeters mercury, HCO3 minus 30 milliequivalents per liter. Which condition? A. Metabolic alkalosis, B. Respiratory alkalosis, C. Respiratory acidosis, or D. Metabolic acidosis. The answer is A. Metabolic alkalosis. Rationale: high pH equals alkalosis, high HCO3 equals metabolic. Strategy: vomiting equals vomiting acid leaves alkalosis. Question 6. Which client is most at risk for respiratory acidosis? A. Client with emphysema, B. Client with anxiety, C. Client with prolonged vomiting, or D. Client with diabetic ketoacidosis. The answer is A. Client with emphysema. Rationale: COPD equals CO2 retention equals respiratory acidosis. Strategy: think COPD equals can't out the CO2. Question 7. Which client is most at risk for metabolic acidosis? A. Client with renal failure, B. Client with NG tube suctioning, C. Client with panic disorder, or D. Client with emphysema. The answer is A. Client with renal failure. Rationale: kidneys fail equals acids retained equals metabolic acidosis. Strategy: kidneys equals bicarb makers. If broken, equals acid overload. Question 8. Which client is most at risk for metabolic alkalosis? A. Client with persistent vomiting, B. Client with COPD, C. Client with sepsis, or D. Client with DKA. The answer is A. Client with persistent vomiting. Rationale: vomiting removes acid, leaves base, equals alkalosis. Strategy: vomiting equals up, equals alkalosis. Diarrhea equals down, equals acidosis. Question 9. ABGs: pH 7.32, PaCO2 60, HCO3 minus 28. Which interpretation? A. Uncompensated respiratory acidosis, B. Partially compensated respiratory acidosis, C. Fully compensated respiratory acidosis, or D. Metabolic acidosis. The answer is B. Partially compensated respiratory acidosis. Rationale: pH is low, CO2 is high, equals respiratory acidosis. Bicarb increase equals kidney compensation. Strategy: if all three abnormal equals partial compensation. Question 10. ABGs: pH 7.36, PaCO2 55, HCO3- 32. Which condition? A. Uncompensated respiratory acidosis. B. Partially compensated metabolic alkalosis. C. Fully compensated respiratory acidosis. Or D. Fully compensated metabolic alkalosis. The answer is C. Fully compensated respiratory acidosis. Rationale: pH is normal, CO2 is high, HCO3 is high, equals compensation. Strategy: pH normal, but other values off, equals full compensation.
Question 11. ABG, pH 7.28, PaCO2 45, HCO3 18. A. Respiratory acidosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Metabolic alkalosis. Answer: B. Metabolic acidosis. Rationale: low pH equals acidosis. Low HCO3 equals metabolic. Strategy: if bicarb is low, base is gone acidosis. Question 12. ABG, pH 7.46, PaCO2 28, HCO3 24. A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Answer: A. Respiratory alkalosis. Rationale: high pH equals alkalosis. Low CO2 equals respiratory. Strategy: CO2 low equals blowing off alkalosis. Question 13. Which condition commonly causes metabolic acidosis? A. Severe diarrhea. B. Prolonged vomiting. C. Panic attack. D. Pneumonia. Answer: A. Severe diarrhea. Rationale: diarrhea loses base, bicarb, acidosis. Strategy: diarrhea drains base acidosis. Question 14. Which condition commonly causes metabolic alkalosis? A. Overuse of antacids. B. Renal failure. C. Sepsis. D. COPD. Answer: A. Overuse of antacids. Rationale: antacids equals base overload alkalosis. Strategy: antacids equals alkaline. Question 15. ABG, pH 7.20, PaCO2 65, HCO3 30. A. Uncompensated respiratory acidosis. B. Partially compensated respiratory acidosis. C. Fully compensated respiratory acidosis. D. Metabolic acidosis. Answer: B. Partially compensated respiratory acidosis. Rationale: pH low, CO2 high equals respiratory acidosis. Bicarb equals partial compensation. Strategy: all three abnormal equals partial compensation. Question 16. ABG, pH 7.44, PaCO2 48, HCO3 30. A. Fully compensated respiratory acidosis. B. Fully compensated metabolic alkalosis. C. Partially compensated metabolic alkalosis. D. Uncompensated respiratory alkalosis. Answer: B. Fully compensated metabolic alkalosis. Rationale: normal pH, slightly alkalotic, HCO3 high, CO2 high equals full compensation. Strategy: normal pH plus other abnormal equals full compensation. Question 17. What is the priority intervention for a client in respiratory acidosis due to COPD? A. Encourage slow breathing. B. Administer bronchodilator. C. Give sodium bicarbonate. D. Restrict fluids. Answer: B. Administer bronchodilator. Rationale: opens airways, decreases CO2 retention. Strategy: treat cause, COPD equals airway issue. Question 18. What is the priority intervention for respiratory alkalosis due to panic attack? A. Give oxygen. B. Encourage deep, fast breathing. C. Have client breathe into paper bag. D. Administer diuretic. Answer: C. Have client breathe into paper bag. Rationale: rebreathing CO2 restores acid balance. Strategy: bag for panic. Question 19. What is the priority intervention for metabolic acidosis in DKA? A. Give antacid. B. Administer insulin. C. Restrict fluids. D. Encourage hyperventilation. Answer: B. Administer insulin. Rationale: treats cause, high ketones, corrects acidosis. Strategy: fix root cause of acid buildup. Question 20. What is the priority intervention for metabolic alkalosis from vomiting? A. Give antiemetic. B. Restrict potassium. C. Encourage hyperventilation. D. Provide sodium bicarbonate. Answer: A. Give antiemetic. Rationale: stop vomiting, stop loss of acid. Strategy: fix vomiting equals fix alkalosis. Question 21. ABG, pH 7.38, PaCO 230, HCO 318. A. Fully compensated metabolic acidosis. B. Partially compensated respiratory alkalosis. C. Fully compensated respiratory alkalosis. D. Metabolic alkalosis. Answer: A. Fully compensated metabolic acidosis. Rationale: pH normal, HCO3 low, CO2 low, lungs compensating. Strategy: pH normal plus opposite system changes equals compensation. Question 22. ABG, pH 7.52, PaCO 246, HCO 335. A. Metabolic alkalosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Metabolic acidosis. Answer: A. Metabolic alkalosis. Rationale: high pH, high HCO3 equals metabolic alkalosis. Strategy: high pH plus high HCO3 equals alkalosis. Question 23. Which finding indicates respiratory compensation for metabolic acidosis? A. Shallow breathing. B. Slow breathing. C. Kussmaul respirations, deep, rapid. D. Apnea. Answer: C. Kussmaul respirations. Rationale: lungs blow off CO2 to correct acidosis. Strategy: Kussmaul equals compensating for ketoacidosis. Question 24. Which finding indicates renal compensation for respiratory acidosis? A. Increased HCO3. B. Decreased HCO3. C. Increased CO2. D. Decreased CO2. Answer: A. Increased HCO3. Rationale: kidneys retain base to balance excess acid. Strategy: kidneys keep base in acidosis. Question 25. ABG, pH 7.26, PaCO 260, HCO 322. A. Uncompensated respiratory acidosis. B. Metabolic acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer: A. Uncompensated respiratory acidosis. Rationale: pH low, CO2 high, HCO3 normal. Strategy: if one value matches pH and other normal uncompensated. Question 26. ABG, pH 7.55, PaCO 225, HCO 320. A. Partially compensated respiratory alkalosis. B. Uncompensated respiratory alkalosis. C. Fully compensated respiratory alkalosis. D. Metabolic acidosis. Answer: A. Partially compensated respiratory alkalosis. Rationale: pH high, CO2 low equals respiratory alkalosis. HCO3 low equals compensation. Strategy: pH abnormal plus both systems off equals partial compensation. Question 27. Which electrolyte is most important to monitor in metabolic alkalosis? A. Sodium. B. Potassium. C. Calcium. D. Chloride. Answer: B. Potassium. Rationale: vomiting and alkalosis cause hypokalemia. Strategy: K follows H. Low H equals low K. Question 28. Which electrolyte is most important to monitor in metabolic acidosis? A. Calcium. B. Magnesium. C. Potassium. D. Sodium. Answer: C. Potassium. Rationale: acidosis causes hyperkalemia, H shifts into cells, K out. Strategy: acidosis equals acid out equals K out. Question 29. Which ABG value shows severity of respiratory failure? A. pH. B. PaO2. C. PaCO2. D. HCO3. Answer: C. PaCO2. Rationale: CO2 retention equals hallmark of respiratory failure. Strategy: high CO2 equals can't ventilate. Question 30. A client with salicylate, aspirin, overdose is most likely to develop A. respiratory alkalosis. B. respiratory acidosis. C. metabolic alkalosis. D. metabolic acidosis. Answer: A. respiratory alkalosis, early. Rationale: salicylates initially stimulate hyperventilation. Later metabolic acidosis. Strategy: aspirin equals early alk, late acid. Question 31. ABG, pH 7.40, PaCO2 38, HCO3 24. A. normal. B. respiratory alkalosis. C. metabolic alkalosis. D. respiratory acidosis. Answer: A. normal. Rationale: all values within normal range. Strategy: no normal, pH 7.35 to 7.45, CO2 35 to 45, HCO3 22 to 26. Question 32. ABG, pH 7.50, PaCO2 50, HCO3 30. A. metabolic alkalosis with partial respiratory compensation. B. respiratory alkalosis with partial metabolic compensation. C. respiratory acidosis. D. metabolic acidosis. Answer: A. metabolic alkalosis with partial respiratory compensation. Rationale: high pH plus high HCO3 equals metabolic alkalosis. CO2 high equals lungs trying to compensate. Strategy: base high lungs hold CO2 to compensate. Question 33. Which condition often causes respiratory acidosis? A. hyperventilation. B. hypoventilation. C. vomiting. D. diarrhea. Answer: B. hypoventilation. Rationale: not exhaling CO2 retention acidosis. Strategy: hold breath equals acid builds. Question 34. Which condition often causes respiratory alkalosis? A. COPD. B. pneumonia. C. panic attack. D. renal failure. Answer: C. panic attack. Rationale: hyperventilation equals blowing off CO2 alkalosis. Strategy: fast breathing equals losing acid. Question 35. Which ABG abnormality is seen in shock? A. respiratory acidosis. B. metabolic acidosis. C. respiratory alkalosis. D. metabolic alkalosis. Answer: B. metabolic acidosis. Rationale: poor tissue perfusion equals lactic acid buildup. Strategy: shock equals lactic acid equals metabolic acidosis. Question 36. ABG, pH 7.47, PaCO2 33, HCO3 23. A. respiratory alkalosis. B. metabolic alkalosis. C. respiratory acidosis. D. metabolic acidosis. Answer: A. respiratory alkalosis. Rationale: high pH, low CO2 equals respiratory alkalosis. Strategy: low CO2 equals alk from fast breathing. Question 37. ABG, pH 7.31, PaCO2 48, HCO3 24. A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Answer: B. Respiratory acidosis. Rationale: low pH, high CO2 equals respiratory acidosis. Strategy: CO2 high equals acid high. Question 38. A nurse suspects metabolic alkalosis. Which sign supports this? A. Kussmaul respirations. B. Tetany and muscle cramps. C. Warm flushed skin. D. Hyperkalemia. Answer: B. Tetany and muscle cramps. Rationale: alkalosis, low calcium ionized neuromuscular irritability. Strategy: alkalosis equals excitable nerves. Question 39. Which sign supports metabolic acidosis? A. Tetany. B. Bradycardia and confusion. C. Hyperventilation, Kussmaul. D. Hypocalcemia. Answer: C. Hyperventilation, Kussmaul. Rationale: body blows off CO2 to reduce acid. Strategy: Kussmaul equals acid crisis. Question 40. A client with NG suctioning develops which imbalance? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Answer: C. Metabolic alkalosis. Rationale: NG suction removes stomach acid alkalosis. Strategy: suction stomach equals lose acid equals alkalosis. Question 41. ABG, pH 7.28, PaCO2 38, HCO3 17. A. Respiratory acidosis. B. Metabolic acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer: B. Metabolic acidosis. Rationale: low pH equals acidosis. Low HCO3 equals metabolic. Strategy: bicarb down equals metabolic acidosis. Question 42. ABG, pH 7.48, PaCO2 32, HCO3 20. A. Partially compensated respiratory alkalosis. B. Uncompensated respiratory alkalosis. C. Fully compensated respiratory alkalosis. D. Metabolic alkalosis. Answer: A. Partially compensated respiratory alkalosis. Rationale: high pH equals alkalosis. CO2 low equals respiratory. HCO3 low equals compensation. Strategy: both systems abnormal plus pH off equals partial compensation. Question 43. ABG, pH 7.37, PaCO2 48, HCO3 29. A. Fully compensated respiratory acidosis. B. Fully compensated metabolic alkalosis. C. Partially compensated metabolic alkalosis. D. Uncompensated respiratory acidosis. Answer: A. Fully compensated respiratory acidosis. Rationale: pH normal, slightly acidic. CO2 high, HCO3 high equals full compensation. Strategy: normal pH plus 2 abnormal equals compensation. Question 44. Which ABG abnormality is most likely in sepsis with shock? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Answer: D. Metabolic acidosis. Rationale: sepsis, poor perfusion, lactic acid buildup. Strategy: shock equals lactic acid equals metabolic acidosis. Question 45. A client with DKA is expected to have which ABG result? A. pH 7.55, HCO3 30. B. pH 7.28, HCO3 18. C. pH 7.50, CO2 30. D. pH 7.36, HCO3 26. Answer: B. pH 7.28, HCO3 18. Rationale: DKA equals metabolic acidosis. Strategy: ketoacids equals acid equals low pH, low HCO3. Question 46. A client with severe anxiety and hyperventilation is most likely to have A. Respiratory alkalosis, B. Respiratory acidosis, C. Metabolic alkalosis, D. Metabolic acidosis. Answer: A. Respiratory alkalosis. Rationale: hyperventilation blowing off CO2 alkalosis. Strategy: anxious equals alkaline. Question 47. A client with renal failure is most likely to have A. Metabolic acidosis, B. Metabolic alkalosis, C. Respiratory acidosis, D. Respiratory alkalosis. Answer: A. Metabolic acidosis. Rationale: kidneys fail, acid retention, metabolic acidosis. Strategy: renal equals can't get rid of acid. Question 48. A client with COPD is most likely to have A. Respiratory alkalosis, B. Respiratory acidosis, C. Metabolic alkalosis, D. Metabolic acidosis. Answer: B. Respiratory acidosis. Rationale: COPD hypoventilation, CO2 retention, acidosis. Strategy: COPD equals CO2 problem. Question 49. ABG, pH 7.42, PaCO2 28, HCO3 18. A. Fully compensated metabolic acidosis, B. Partially compensated respiratory alkalosis, C. Fully compensated respiratory alkalosis, D. Normal. Answer: C. Fully compensated respiratory alkalosis. Rationale: pH normal, slightly alkaline, CO2 low, HCO3 low equals full compensation. Strategy: normal pH but shifted compensated. Question 50. A client with prolonged gastric suctioning is at risk for which imbalance? A. Respiratory alkalosis, B. Respiratory acidosis, C. Metabolic alkalosis, D. Metabolic acidosis. Answer: C. Metabolic alkalosis. Rationale: gastric suction removes acid alkalosis. Strategy: lose acid equals alkalosis. And that is it for the 50 acid-base balance questions made simple. Lightbulb, if you made it this far, you now have the tricks to tackle ABGs with confidence on Nclex. Remember, practice these strategies until they become second nature, and you'll never get stuck on an acid-base question again. Keep pushing, keep practicing, and I'll see you in the next session, where we'll unlock even more Nclex secrets.